Hello, my name is Bridget. I'm a family nurse practitioner. I make videos on nursing, health, and wellness and mental health. If that's something that you're interested in, make sure that you hit the like button, make sure that you subscribe, and make sure you turn on that notification bell. So today I'm going to be giving you an update on the coronavirus. So let's dive in. I will talk a little bit about the virus, signs and symptoms, how it is transmitted, and how many cases are there in the United States, what's the recovery rate, and how many people have died from this virus. Let's go. So the World Health Organization has now renamed the virus to be the COVID-19. Part of it is also to avoid the racist attacks that have been happening against Asians. Please, in this moment that we're all going through this together, we are all one, we are all humans, okay? As cliche as it is, it's true. We all bleed red, and this is a time for unity. It is not a time for division. It is not a time for blaming, okay? So you can't generalize. You can't place a stigma on individuals, okay? So that is why the World Health Organization decided to rename the virus in order to avoid stigma, racism, xenophobia, etc. So what is the incubation for the coronavirus? And what does incubation period mean? So the incubation period just basically means from the time that someone, let's say I have the coronavirus and I give it to someone, when will that person start displaying symptoms? It could be 2 days, it could be up to 14 days. And that is according to the CDC. And transmission is believed to occur via respiratory droplets from coughing and sneezing. Now, they can also be transmitted if someone touches a surface, like they leave a dirty tissue or they touch their nose and then they touch a counter, but that is a less likely way. Is coronavirus worse than the flu? Depends on who you ask. There has been some healthy debate between myself and my colleagues. COVID-19 may be more deadly. In my opinion, it is. The flu's estimated death rate is about 0.1% compared to the coronavirus, which is estimated at 2 to 3% mortality rate. Some argue that it's difficult to know a true death rate because people that have had mild cases may have never been diagnosed. And there was a recent editorial in the New England Journal of Medicine that stated that the actual death rate may be closer to the flu in a severe season. So just so that you get a picture, there have been at least 29 million Americans sickened by the flu this season. However, even though there have been deaths from the flu, there is only a 0.1% death rate based on those 29 million that have been infected. So in the United States right now, there's 127 cases of the coronavirus. I will show you a mortality rate and a recovered rate. And in my opinion, it does not look good. I will discuss that, so make sure you stay tuned. So there is stipulation that this virus is more deadly. The issue is that the flu is well known to scientists and doctors, and although each year's strain is slightly different, flu treatment plans are well established, right? We have vaccines, we have Tamiflu. So this strain of coronavirus is brand new, and health officials are still learning about its spread. There's a lot that healthcare providers still do not know. It's also possible that the virus mutates into multiple strains as the flu has. So Tedros Adhanom, Tedros, the Director General of the World Health Organization, said there are some key differences people need to understand. I'll hit you with the good and then with the bad. So the good is that COVID-19 doesn't seem to spread as efficiently as the flu. This is what he said, even though from everything I've been reading, every person that is infected with coronavirus seems to be spreading it to at least 2 or 3 people. But hey, this is what the Director General of the World Health Organization is saying. The second difference that's not such good news is that people that do get COVID-19, they do tend to get sicker than people who just have the flu. The reason for this is that many people globally have built up immunity to seasonal flu strains. COVID-19 is a new virus strain that no one has immunity to. So that means that more people are susceptible to infection and some will suffer severe disease. It concerns me because, for example, my father has rheumatoid arthritis. He takes immunosuppressant drugs. He's 59 years old. So it's possible, because he's taking these immunosuppressant drugs, that if he gets this coronavirus, it's a wrap for him. It's a very real possibility. Who's most at risk? So according to the World Health Organization, cases in China have been adults older than 40 with a 78% male predominance, and 32% of patients had underlying disease. This is not to say that young patients cannot get it. They still cannot. They still can get it. What is the most common symptom of COVID-19? Fever, cough, shortness of breath. So if you have a runny nose, probably not COVID-19. I'm not going to say that 100% it's not, because people present differently, but the three classic symptoms of COVID-19 is high fever, cough, and shortness of breath. So please, if you think you have COVID-19, do not go to your nearest urgent care. Do not go to your retail clinic. Please, you're exposing a lot of people. You need to call ahead, probably the emergency department. Call the hospital and tell them, hey, I think I have coronavirus. I'm going to be coming, right? Because they need to prepare for you. They need to put you in an isolation room. They need to wear the appropriate protective equipment. So please be smart. Call ahead if you suspect you have COVID-19 so that the facility can prepare. And currently the CDC is supplying the test kits. Don't just show up and be like, hey, I'm here to spread the coronavirus to everybody. Let's be conscientious of other people. How to prevent COVID-19? Wash your hands, right? Wash your hands well with soap and water, and sing a full happy birthday song, right? Don't touch your face, mouth, don't touch your face, right? Don't touch your mouth, nose, or eyes. You have mucosa here that's very susceptible to absorbing things. So don't touch your nose, don't touch your eyes, don't pick your nose. Avoid contact with people that are sick. I mean, unfortunately, the kind of work that I do, that's all I deal with every day, sick people. So there's really no going around that. So if you work in the healthcare field, protect yourself as much as you can. Stay home when you are sick. If you're going to cough into your elbow, or sneeze into your elbow. As promised, I am now showing you the COVID-19 global cases by Johns Hopkins. This data has been compiled by the World Health Organization, CDC, ECDC, NHC, and DXY. Because I am in the United States and most of my audience is in the United States, I will go over the United States. In the United States, there are currently 128 cases of COVID-19. There have been 9 deaths. 8 deaths in King County, Washington, USA. And 1 death in, I can't say this county. 8 people have recovered. Now, just by looking at this, if I didn't know anything else, I would say this is very alarming that 9 have died and 8 recovered. I mean, just by looking at this, if I had no other data, I would say this is very alarming, that 9 have died. One thing, though, that I do know is that this outbreak happened at a long-term care facility. So in general, the individuals that are at this long-term care facility do tend to be elderly. They do have additional health complications. But we can't discount this. This is why I'm concerned. Because yes, people are recovering, but a lot of people are dying. To have this many cases and already 9 people dead, it does concern me. So this is not a time to panic, but we do need to prepare, and people are preparing. I mean, there are facilities where hand sanitizer is out, Lysol wipes are out. So, prepare, but also leave other items for other people to prepare. Take what you need. This is not Armageddon. Just be conscientious. Stay home if you're sick. If you feel like you may have coronavirus, call the hospital ahead. If you feel like it may be coronavirus and you're having shortness of breath, you need to go to the hospital. Do not wait until the last minute where your symptoms are so severe that there's nothing else they can do. Unfortunately, at this moment in time, we do not have a vaccine. We do not have medication. As of March 4th, 2020 at 12:25 p.m., but they are working on a vaccine, so we may have something here soon. This virus can continue to mutate, so it could go one of two directions. It could mutate and it becomes less severe with the change of weather. Maybe it'll die down, or if it mutates and it becomes more severe, we don't really know what's happening, and that's what's important. I don't think that we should be dismissing this and saying like, oh, don't worry about it, it'll go away. No, it's important to stay informed. It's important that if you are around people that have immunosuppression, that you do your best to not take this condition home. So I hope this video has been helpful. Let me know if you have any questions, concerns. What most doctors, physicians have been saying is that 80% of the cases will show mild symptoms and 20% will develop severe symptoms. Once again, make sure you hit the like button, make sure that you subscribe, and make sure you turn on that notification bell. Bye.